Let's discuss some tips to avoid or prevent a stress fracture. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt: The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Stress fractures can derail a sports season or training for a big event. They're nagging injuries that come on over time but can lead to a long time out of that sport or out of that type of exercise. And so better than treating one once it's happened is to prevent it from happening in the first place. So I want to talk about 4 tips that I think can help you avoid a stress fracture. The first, and honestly probably the most obvious but maybe the most important, is don't train or don't increase your training too quickly. This is a big deal because that's how most of these happen. You go basically from 0 to 60 without enough time to recover. Basically what happens is you have these microscopic stresses. Every time you run or do whatever it is, it's usually running, but whatever the training is, and that microscopic stress on the bone can heal with a day or 2 of rest. But if you keep increasing your training and pushing too hard without enough time to rest, those little microscopic areas of damage become bigger areas and you ultimately can develop a stress fracture. So don't increase your training too quickly. Set logical increases over time. With running, we talk about how that's increasing 10% per week. So if you run 10 miles a week and you want to increase, the next week you increase to 11 miles per week. But that allows your body to adapt to the training to basically heal without developing a stress fracture. All right, the second one along the same lines is set realistic goals for your training or for your competition. So I think it's great if you want to run a marathon or a half marathon, but you have to give yourself enough time to get to that level. If you're basically only running 3 miles a week, then basically running a marathon a month from now, you're just not going to get there in time. So just for instance, take our 10% rule. You think, all right, I can run 10 miles per week now. If I increase 10%, that's 11 miles next week. The week after that would be 12.1, and you increase it a little bit at a time. So then work backwards. All right, if the marathon you want to run is Christmas Day, for instance, how long, basically how many miles a week do I need to be training to be ready? And then if that's, let's just say 50 miles a week, and you work backwards and at that 10% rule until you see where you are now. And if that's 9 months or a year of increasing your training, so be it. But what you don't want is to ramp up your training quickly and then 6 weeks before the race you have a stress fracture that you can't train through, and you basically lost all that training and you can't perform in that marathon coming up. So set realistic goals. The third one would be, if you start developing pain, take a few days off and maybe let that bone heal. Maybe there's a non-impact type of exercise you can do, like swimming or stationary bike, that lets you to get some exercise but avoids the repetitive impact that causes that pain. And if it gets better in a few days, then great, work back in to what you want to do. But if it's not getting better, then you get it checked out. These injuries, these overuse injuries, are much better if you can catch them early than if it turns into a full-blown stress fracture that might keep you out 6 or 8 weeks. The last one is, if you've suffered a stress fracture, or maybe you've suffered several, not a bad idea to consider getting a bone density study. And this may be true generally if you're getting into your maybe mid to late 40s or 50s or further, maybe something you do on a maintenance basis. But one of the risk factors with stress fractures is osteoporosis, or maybe not full-blown osteoporosis, but osteopenia, decreased bone mineral density. So consider getting that checked. Talk to your doctor about that. Because at the end of the day, we want to prevent stress fractures. I love treating them for sure, but I would much rather you not need to see me in the first place for a stress fracture. All right, do you have any other suggestions to prevent a stress fracture? I'd love to hear them, so honestly I can share them with my patients and I can share them with people watching these videos. So below this video in the comment section, please offer your suggestions. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. Click the subscribe button in the upper right corner of the page. I record several of these videos every week. I do live videos and I answer some of your questions, and I want you to be notified. So if you subscribe, you'll get notified about those. Thank you so much for watching, and I look forward to seeing you right here next time.